Good afternoon, everyone, and a very warm welcome to all of you joining us today. Today marks the first event in a brand new online series, Kargar Expert Insights, with an India focus, created specially for Indian researchers at all levels, from career scholars to experienced academicians and clinicians. We are excited to kick off this dedicated space for learning, discussion, and practical support for your publishing journey. For those of you who may not be familiar with Kaga, we are a global publisher in health sciences based in Switzerland. We have been publishing peer-reviewed medical journals and books for over 135 years. Our full portfolio of titles is available online. We'll be sharing the link to explore it in details in the chat shortly. But today's focus is all about you and your research. We will talk about how to write your research successfully, giving it the best possible chance to be published in reputable, trustworthy journals like Kargar's, and how to avoid the most common pitfalls along the way. But before we start, just a bit of housekeeping. This session is being recorded and the link will be shared with all of you afterwards. You can drop your questions at any time during the presentation in the Q&A chat box, and we will do our best to answer them during the live Q&A at the end of the session. This will be a dynamic and interactive sessions. We'll be launching a few quick polls to hear about your experience as researchers, so do keep an eye out and join in. And finally, as a small thank you for all of you joining us today, we will be sharing a free online course on how to write a compelling case reports available to you until the June 8th. We'll be sharing a link at the end of this session and include it in the follow-up emails with the recording. So don't worry, you won't miss out. Now I'm delighted to briefly introduce you to our speakers for today. We are joined by Dr. Ines Perez, who's a PhD in evolutionary biology and is a publication manager at Kargar Publishers, who will guide us through the session with practical insights into what journal editors look for, common writing challenges, and how to make researchers more accessible. And we are honored to welcome Professor Dr. Uday Ghoshal, full professor at Sanjay Gandhi PGI, former professor, head of department at gastroenterology in Sanjay Gandhi Postgraduate Institute of Medical Science, also the president of the Indian Society of Gastroenterology, and an editorial board member of Kargar's journal Digestive Disease. Professor Ghoshal brings a unique perspective both as a published author and as someone who helps evaluate and shape the research and gets published. Thank you once again for joining us. And now I'll hand over to Ines to get us started. Ines, over to you.
Yes, thank you very much. To start with, I would actually like to have a feeling for the audience. So I would like to start with a poll where you can answer if you have published before and give us a sense of how much, if you have published a lot or just a couple of articles. Yeah, the results are coming in. Okay, I can see the majority for now is in the not at all or few articles. Yeah. Okay. Couple more people answering. This is great. Okay, perfect. So it does seem that the majority of the audience has either not published at all before or published 1 to 4 articles before. So I'm actually glad to hear this because I hope this presentation is quite useful in particular for that group. And a few things will be probably more useful for the more experienced researchers and medical doctors out there. Okay, so where do you start? If you haven't never written an article before, that's probably a question that you have. And we've all heard you have an hypothesis, you build a methodology to test that hypothesis, and you go from there. But we all know that, on our regular in our lives, things are not as straightforward as this line shows, and often a new question or a new methodology shows up at a different time point, and the story is not as the line goes in here. I nevertheless encourage you to always think about the story. A good article has a story. It has a beginning, a middle, and an end. And that's what makes it compelling. Even if we are talking about science, it's important to think about the story. And that will also help you about thinking about what methods, what tests do I need to do after, what would make the story, interesting when I'm reading. I tested this part, but I need to test something else. That's what the reader would expect. And I highly encourage you to think like this from the beginning of your research, and to build supporting literature as you go along, of course, and get feedback regularly. So what types of articles are there? Of course, the research article, probably most of you are very familiar with it. The review article, the systematic review is also very common nowadays. But there are also case reports focused on one or several cases. There are clinical trials and registered reports. I'm going to go over a bit the research article, the case report, clinical trial, and registered reports, and not touch so much the review article and systematic review today. So now a question again for the audience. The ones that did publish, which articles have you already published? So that we have a sense if you are acquainted with these article types already or not. Okay, great. We have the answers coming. As expected, the majority has written and published research articles or review articles, the most common ones. I do see case report coming up. That's good. Okay. A few more answers. Yeah. So, over 60% have published a research article, as is expected, as the most common article type. But we have over 40% of review articles, a few systematic reviews. But I'm glad to see that over close to 17% have published a case report and 11% a clinical trial. It's good to remember that there are other article types out there that can be useful sharing to share your research and your results with others. Okay, so what's a research article? Especially for those that have never written and are just beginners to all of this. A research article reports on primary research. And at Carger, this includes clinical trials, as we do not separate these two as two different article types. I will nevertheless focus a bit more on clinical trials later on today's webinar. The research articles must describe significant and original observations and are considered for publication based on articles' originality and suitability of experimental designs. So if the methods are suitable for what is being tested and tried to be answered with the research article. The authors must follow the Equator Network guidelines for research articles, and I share here the link for you to explore later on. A research article is composed of an abstract of about 250 words, more or less, then an introduction that clearly sets the stage for the topic of the research article, then materials and methods that specify the methodology that it was used. The results section presents the results, and then a discussion of the results and a brief conclusion. So now I have a question for Dr. Uday. What role does the discussion section play, and how can authors effectively interpret and present their findings without overstating the implications?
Good afternoon. I think it is a very important question. In fact, the discussion section is the one which reviewer or editor like to read and see whether the article is up to the mark or not. So when you talk about IMRAD format, IMRAD means I stand for introduction, M stand for method, R stand for result, and D stand for discuss. Let me tell you, introduction means why did you do the study? Method means how did you do the study? Result means what did you find? And discussion means what do all these mean? What you found, what do all these mean? So it is very important to interpret what you found. So typically I like to first para of the discussion I like to write as bullet point what are the major observation that this study showed, and also look at the originality. What you found, are these really novel? Because if these are novel, journal will be more interested in it. Subsequently, each of the para that you write actually should discuss those bullet point one after another. And typically, the beginning of that paragraph should raise a question. And you should bring the earlier studies in context of your observation, and the end of the paragraph, you must write something more like a conclusion. So the reader can read that it looks like a story where you raised a question, you discussed your finding in the context of other article published already, and then finally you are stating what does it mean. Also in the discussion section, you must give the strength of your study. And in the another paragraph, you must give the weakness or limitation of the study, because typically editor and reviewer like somebody, an author who can find out the weakness himself or herself. Then the interpretation of the result of the study looks more believable, more realistic. And this section is very, very important. And finally, end of the discussion, you must conclude. So basically, discussion means what do your findings that you got in this study mean in the context of earlier literature, and you must bring out the novelty of the study in your discussion.
Thank you very much. Those are great insights from an author and editor. That's indeed very important. Okay, so moving to a different article type that some of you already have experienced writing, it's the case reports. The case reports present significant new insights or cases with an unusual or noteworthy course, and should provide a new perspective on a recognized clinical scenario or present a new clinical condition. Here it's very important to note that not all journals consider case reports for publication, because this is a short form of an article type. Um, so it's important, if you are planning to write and working on a case report, that you find journals that publish case reports. So case report journals, for example, the case reports in gastroenterology journal from Karger, of course, only publish case reports. But there are other journals that are more general, that publish several article types, including case reports, like, for example, Biomedicine Hub. However, if you are working on this article type, please do check if the journal that you would like to submit to considers case reports ahead of time. So what's the structure of a case report? Case report has an introduction, provides a summary of the specific problem and the clinical significance of the case report. Presents, and then a case presentation that introduces the case, medical history, methods, states how the outcomes were assessed, follow-up, and again ends with a discussion conclusion. And there should be a clear discussion of the implications and significance of that particular case to the reader. And of course, the present whether the data support or contradict previous studies and so on. I recommend this for anyone writing an article, any article type, but especially for article types that are less common. I do recommend you to use the templates often provided by the journals. And I give here one example, but you can find for sure in the guidelines of any journal templates of the article type that you are interested in, and start working from within that format, because that will be very helpful for you at submission if you have everything already in the format that the journal requests. So case reports have essential requirements. They need ethical approval, they need patient consent, of course, and they have to follow the care checklist and provide the care checklist. So another question for Professor Uday. What distinguishes a strong case report from a weaker one in terms of data presentation, objectivity, and relevance to clinical practice?
This is a very important question. Let me tell you, generally journals don't consider case report very often. Why? The reason is that it reduces impact factor of the journal, because if we publish 10 case report, obviously we have 10 citable items added to the journal. But we know that these case reports are unlikely to be cited by anybody. So now, can you make a case report which is very highly citable? Yes, you can. If something is novel, let me give an example. HIV was first described as case report or case series. Somebody found that he gets a patient who is having severe immunodeficiency, but this is not because of immunoglobulin deficiency or congenital immunodeficiency syndrome. And this led to discovery of HIV. If you look at IBD discovery, somebody found that patients who have joint disease, often they come with diarrhea, and when they are given cefalopyrin for joint disease, their diarrhea improved, and that led to recognition of IBD. Very novel. Another example, celiac disease during a World War, scientists from UK found that children with chronic diarrhea, the diarrhea reduced or disappeared And he correlated this with the lack of wheat or bread in their food, because what is the situation of food crisis. So these are very, very novel. Journal would be interested. But if something is described already, well described, let us say you describe something like Helicobacter pylori infection with multiple gastric polyps, which journal is going to publish it? Because we all know Helicobacter pylori can cause gastric polyp. So there is no novelty. Also, sometime in the case report, it is good to record the data with a lot of quantitative items. If you have only qualitative or subjective item in the case, it is unlikely that it will be very interesting. On the other hand, if you have a lot of quantitative item, such as some uh, uh, disease score that got reduced after treatment or did not reduce after treatment, something else, for example, some laboratory values which increase and decrease. So in a given case, you are using the same patient as control, and you have observations which are continuous, and you are showing the effect of treatment. And even in case series, you can do statistics out of it. In case series, you can show that how a novel treatment led to improvement in clinical quantitative scores or laboratory quantitative score. So the two major things are, one is how you depict the data. Do you have quantitative data? Do you have within the case or case series, do you have comparator? And second thing is it novel enough to sort of make the journal high impact? So these are the two important items.
Thank you very much. Those are great insights and examples. I'm going to use them later on. Thank you very much for sharing those. Okay, so moving on to clinical trials. Cargo journals require completed consort checklists for clinical when submitting the results from a randomized controlled clinical trial. Prior approval from an institutional review board or an ethics review committee is required for all investigations involving human subjects, and trial registration details must be provided in the submitted article already. Another form is the registered report. This is slightly less known compared to clinical trials, but it has similarities. So you do a pre-registration of the methods, and you first publish the protocol, the methodology that you will follow. That's stage one. And then later on, you conduct the study, and then you publish the results, the research article with the results of that study, irrespective if the results are negative results or not. You publish them. Again, here, not all journals considered for publication registered reports. An example at Cargo is Biomedicine Hub, but there are other journals that do consider for publication. If you are thinking about writing and conducting a registered report, do check the journals first if they consider it for publication or not. So for pre-registration, both for clinical trials and registered reports, you need to do a pre-registration, and I provide here some QR codes. We will share the video later on, so if you don't have time to get the website now, don't worry. The clinical trial registration is well established, expected in the community, and can be linked to any publications via Universal Trial Number Code. Registering study protocols is less common. Registered reports are also less common, but it makes the research planning and analysis a lot more transparent. The protocol, so the methods article, can be published in a journal and cited even before you get any results. and consists, as I mentioned, of two parts. So a methods article and a research article that then presents the results. So now a question for the audience. From the article types that we have mentioned here, or after we discussed all the article types here, especially the ones less common, do you feel encouraged to write an article type that you haven't written before? Okay, results are coming. I have to say I'm happy to see that the yes is is at the top, so that's great. And hopefully we are providing you with the tools that you need to try a new article type. Okay, 68% say yes, I feel encouraged to try a new article type. That's great to see. Again, these resources will be shared, so hopefully you have everything you need to try a new article type. So, and we were talking about pre-registration, and this is one aspect of open science practices, but there are other aspects that I would like to mention because nowadays it's more and more important. So other aspects are involving citizen scientists or impacted community members like patient organizations and things like that. Publishing preprints, using a reporting checklist when writing a manuscript, sharing your data is more and more important, sharing your code if you are using code in your research, publishing in open access journals. If this is very important to you, always check ahead of time. Peer reviewing others' research for open science practices, and making your research available in multiple languages is also a way of practicing open science, of course, and accessible communication of research. I share here the link to the UNESCO recommendation on open science. Authors and publishers are more and more encouraged to follow these practices. So please do feel free to explore a bit more on this and see what you can do and what makes sense for you in your research to apply. A little bit on data and code sharing. What you can or not share. Of course, we here in this webinar we are talking mostly to medical doctors, so research in the medical field, which means you have to be careful with the data, of course, and how you share it. It doesn't mean that you don't get to share it. You just have to pay more attention to it. So again, you have resources on the site. But remember, you have to share what's ethically shareable, legal, of course, to share, permitted by the data owner. So the case reports, for example, they have to have patient consent, of course, and you have to follow funder requirements if there are specific requirements from the funder. Where do you deposit the data or the codes? There are repositories, there are institutional. An example is Manchester Figshare. There are specialty specific, like the Binding DB, and there are generalist repositories like Figshare, Triad, GitHub, etc. Any repository that you use should provide a unique identifier and have a data management plan for persistencies of the identifier. Many of these repositories offer curation to improve data reusability and lookup certifications, for example, Core Trust Seal, to ensure it meets ethical sharing expectations. When should you share your data? Start your data management plan and discuss the data and code sharing right from the beginning. When you are already, when you were before, ideally, or when you will start collecting data, is when you should be discussing what data are we sharing, in what format, where, so that all collaborators, all co-authors are aligned, and you already collect the data in a way that then it makes it much easier to submit to the repositories and so on and so forth. And when you submit your article, you can already use the identifier and so on for the data, and you know what to answer to the data statements that are required with the articles. Okay, so now the question, we talked about originality of the articles, new insights, and so on. The question is, if my results are negative or, inconclusive, and I don't have the originality that I need, well, there are places still to submit and to publish these results. There are, for example, another example for Biomedicine Hub, a cargo journal that is not focused on impact factor. It's focused on the suitability or the correctness of the science. So here, for example, you can publish negative results. There are other journals out there that specifically mention they're open to the publication of negative results. So do not feel completely discouraged if your results are not what you would like them to be. Just explore what other possibilities are out there. So a question for Dr. Uday. Have you personally experienced a situation as a clinician, researcher, or editor where negative results were of value to you?
Very good question. I tell you, negative results are of immense value. Today, we are practicing medicine, and let us say there is a medicine which has been said to work in 90% or 95% of the patient, according to textbook, according to review article, according to meta-analysis. But when I use the medicine, I realize that this is not correct. In my patient, it works only in 50% or 40%. So where is their gap? That literature says 95%, whereas my clinical experience is 50%. This is because literature did not publish the negative result. It is not only the fault of the author. See, what happens is most journal over many years have rejected negative result outrightly without realizing what they're doing to the science. So now author gets discouraged to write negative result. The editor doesn't accept the negative result, outrightly reject. Peer reviewer do not like them, and even the readers don't read. But realize because of this, our literature is full of only positive studies. Those studies which were negative did not get published, and therefore what you are seeing in the literature is not what truly happens. It is far from reality. And now those positive results are meta-analyzed, and now people say this is the strongest evidence. But you realize the strongest evidence is not gold standard, but unfortunately iron standard. So therefore, I'm sorry to be provocative and very sort of truthful, but this is the case. Me as a clinician, we are always interested in negative result as much as positive result.
Thank you very much. That's great to hear, because it's indeed something that we are pushing for also as a publisher, and that's why we are happy to provide Biomedicine Hub as a space for this. And we have currently an open call for papers on negative results on Biomedicine Hub, because we agree that negative results are as important as positive, let's say, results. Okay, so you have submitted your article. You have finished the story, you have submitted it. Are you done? Unfortunately, no. You still have to go through peer review and you have to reply to reviewers' comments. Again, you here on the side, you have resources that you can explore later on. And there's a range of types of reviewers, reviewer reports, let's say. We all know they exist. You have the good, the reviewer that understood your work, the contribution of the article, and asked for minor changes and clarifications. You have the bad, the reviewer that understood but doesn't recognize the relevance of it, or proposes a lot new experiments that would take a long time to conduct. Um, and of course the ugly, the reviewer that completely misunderstood your article, your work, that doesn't understand the point of it, and is states that the article is unsuitable for publication. You still have to respond to all three, and believe me, I've been an author myself. I've been seen the range of review reports and felt sometimes very upset. What I recommend is take your time. Don't reply immediately. Breathe. Take your time. Discuss with your co-authors, and then prepare a point-by-point reply where you acknowledge the correctness of their comments or gently point out the potential misunderstanding. You explain the changes that you made to address their comments. Draw parallels between reviewer comments. So most article types, you will have at least two reviewers, and if you see the same comments coming from the two reviewers, mention that both reviewers mentioned this and we addressed it in this way or that way. Um, don't be afraid to add structure to the comments of the reviewers to help you respond clearly, and write a summary paragraph of all that has changed and in the new version of the article. So here again, the personal experience of Dr. Uday will be great. So, can you offer our audience any practical advice for responding to peer review comments constructively and professionally, even when they feel critical?
Yeah, very good question. And at the same time, a quite difficult question. But I'll give you some advice because I've worked with several journals as an editor or associate editor, but also I have authored about 500 articles. So therefore, I'll tell you sometime the pain. But let me tell you, the moment you get the reviewer comment, you should be angry. You know why? Because you have done with a lot of passion the work. You love the work so much. You have spent so much sleepless night, and one reviewer just gives a comment which actually negates all your hard work. But the best thing is time is the best healer. Reviewer is trying to help you because reviewer is neutral. He doesn't have that passion for the article what you have. So therefore he has seen the article neutrally. So typically what I do is I read the comment of the reviewer and be cool for next 2 to 3 weeks, because time is the best healer that reduces your, I would say, if I'm allowed to say, anger. Then you will find within the reviewer comment there is so much material that can take your article to a much greater and greater level. And I have articles where we found that initially we did not do so well, but after 2 or 3 times peer review, the article becomes so good that I can't myself appreciate that I have written this article. So the reviewer is doing a thankless job. He's spending time with your article, trying to improve your article. Never be angry with him. Be respectful to him. Even some comment may be a little silly what you think, but the reviewer is a fellow who might have worked in this field for longer time than what you have done. Now, second thing, sometimes reviewer even may show ignorance. but use that as a stepping stone to actually get the article published. For example, we wrote an article on artificial intelligence for prediction of outcome of chronic liver disease in 2003. And when nobody was talking about artificial intelligence in gastroenterology. And unfortunately, one of the reviewer actually wrote, "This is all nonsense." And this was a confidential comment to the editor. I do not know how this comment came to us. So we used that as a strength, and we said that the reviewer must be most knowledgeable person in the field. Even then also we are sorry that we could not communicate our result to the reviewer who must be most knowledgeable in the field. So therefore we are giving a very simplified diagram so that our reader who are less knowledgeable than the reviewer can understand what we are meaning. And then complex mathematics, we give a very simple flow diagram, and I tell you, the article when we submitted, within 4 hours I got acceptance. That is, the editor realized the ignorance of the reviewer in that field, because that was an evolving field. He realized this paper is better not send out for peer review again to the same reviewer, but accept. So therefore, reviewer, if some more time he gives a comment which is a little silly, it is better to use that in a positive manner rather than negative manner. So each comments are important. They should be addressed in point by point responses very carefully. And also whatever has been given in the point by point responses, you should also give in your revised paper. I always make a different color font so that reviewer can read without again spending many hours what changes we have made. So in the first peer review, I will give in the revision, I'll give maybe red font. Second, I'll give blue font. So often what reviewer do is that if you submit the peer review quite quickly, they look at your different colored font or maybe bold font, and they read this much, may not go back again to the whole article. That hasten your process of acceptance.
Yeah, again, great insights and personal experiences. I'm happy to hear that, and I'm sure the audience is. This will be quite useful for the audience to hear. Um, okay, so you have a few more resources in the end, and before I open to questions from the audience, I have one other question to Dr. Day. So, given your experience both as a researcher and editorial board member, as you mentioned in several journals in different roles, what unique challenges do Indian researchers face when aiming to publish internationally, and how can these be overcome?
Yeah, one of the challenges that you see often India is a big continent or big country. So therefore, many a time we remain confined within India. We say this is new for India. This is original or novel for India. The moment you say that, basically, you are actually making your article regional. I would say do not do that. Many articles write in the title, even I might have published earlier in my title, so and so in India. So the moment your title starts with India, that global sort of need of the paper is gone. So you are doing an experiment or a study among patients, and that is very generalizable maybe to the whole world. So if something is generalizable to the whole world, then only the international journal will like to take it rather than very regional kind of observation or hypothesis generation. That is one. Second is, yes, English is not our mother tongue. Therefore, sometimes you may have limitation in English. There is nothing wrong in it because we think in a different language. Then we convert that thinking into English language. Nowadays, there are several ways to improve upon your English. There are several online tools. Also, you see, write short sentences in active voice. Do not join multiple sentences because that create a lot of confusion in both how you are trying to communicate and how you are actually how readers are understand. Third thing is that if you do a single center study on a small number of patients, it is unlikely to get placed in a big journal. So obviously, these studies are single center. They may not be generalizable even within the country. So therefore, to make these studies robust, you should have similar minded doctors or researcher and you work together so that this will be collaborative research. And keeping collaboration over long period actually improve your credential, your international recognition, and you get a better chance of publication. Though we know the peer review should be double blinded, but truly speaking, that doesn't happen. If a group is repeatedly producing a science on a particular field, they become more sharp and they become more recognized worldwide. So, therefore, it is a time to unite, work together, collaborative research, and the idea must be very, very novel. Also, if you have a hypothesis, and that hypothesis is very global, need of the hour. Let us say we publish from our center the first article on post-COVID-19 IBS. So this was first article in the world. Obviously, you expect it to be quickly accepted by the journal because it is fast. So your hypothesis should be something like very novel, maybe first time. Multiple centers should collaborate so that you can give big sample size, you can give robust data, generalizable data, and you must avoid writing from India or in India because you are making it regional.
Yeah. Again, great insights. Thank you very much. I remind the audience that you are feel free to ask questions through the appropriate space. Uh, I see that we have already one question, probably best for Dr. Day. How important is the cover letter to the editor when submitting the paper, and what should it include in your experience?
Very good question. The editors are all busy. So basically, a good cover letter may be your at least beginning of the success. Because what you should do is that in the cover letter, nowadays a lot of journal says you write what is already known, what is new in the study, and what is the practical implication of this point. Now, this is given as a text box in many big journals now. So in the cover letter, your way to write should be that. You should clearly in 2 to 3 sentences write what is known. And then in another 2 to 3 sentences, you should write that what is new in this study, which actually overcomes the knowledge gap. And lastly, you should write what is the clinical implication or research implication of this finding. So what happens is many a time editor might read only the title, maybe the abstract, or if there is a good cover letter, he will only read the cover letter and decide whether to send it for peer review or to reject outrightly. That is one. And second is also he decide who should be the peer reviewer. So if you get a person as a peer reviewer who believes the same as you do, actually you have a greater chance of success. I listened from Barry Marshall, who won the Nobel Prize of Medicine, that he was trying to do a PhD, and many people did not encourage him. Now, what happened is Robin Warren thought or believed that he believed that stomach, in spite of having so low pH, can have bacteria there. And somehow one fellow told Barry Marshall, you go to Robin Warren and tell this to him, he will accept. And he did that, and immediately Robin Warren embraced him. So it is similar. So if you think, like if I think that COVID can lead to IBS, and if I get an article which is beautifully describing the proof that yes, it can, you are likely to get a better treatment. But again, I'm sorry for telling you the inside truth, but we are all human beings. So the cover letter should state
Yeah, couldn't agree more. So we have another question. In the absence of global data, how do we generalize the observations for the paper to have an international feel? Can we include observation or data from other countries as part of the study for making these observations? Is there some guidelines around it?
Yeah, you see, you are talking something like a meta-analysis. So let us say you found something novel and you want that you should actually see in the context of earlier observation, does your finding or do your finding give some novelty? Now, I would say yes, you can, because anything that has been published is in public domain. So therefore, you can use those data. So therefore, I can say that present this as a original article, but also within the aim, you can say that we want you to meta-analyze the earlier data to see how our study is novel and whether it is applicable to the global data, and then do a meta. When you do any meta-analysis, you are supposed to follow the Prisma guideline. You are supposed to register also in Prospero. So do that. You register in Prospero, follow the Prisma guideline. In your original article itself, you can meta-analyze. If you do not want to meta-analyze, you can make a systematic review. So you can say original article along with a systematic review of the earlier literature.
Yes, very detailed answer. Okay, I don't see any new questions. So I think for now the audience is happy. Again, you have our cargo contacts if you want to reach out at a later point. I hope the resources will be useful for you, and please stay up to date with these events, registering to the newsletter. You can find the link for registration right now up from the QR code, but you will have it later on as well. And thank you very much, Dr. Uday, for your very, very insights, very important insights, and personal experience as an author and editor. I'm sure it was very helpful for the audience.
Thank you. Great initiative.
Thank you, Ines. Thank you, Dr. Uday. Thank you all for so much for joining us today, and a big thank you as well. This was such a insightful session. I'm not an author, but yes, definitely some pointers that we keep getting asked when we visit institutions. So it was really helpful in knowing what to avoid to become successful as an author. Always helps encourage new writers to publish more with us. Just a few things. As a reminder, you have a free access to our online course, as we mentioned earlier, on how to write a compelling case report. It is available to you till the June 8th. Please register. To access this course, you'll have to first register or create a MyCarger account if you don't already have one. You can do that on our carger.com website. Just follow simple steps, first name, last name, and email address, and you should be good to go. You will get a dedicated link. We will share with you in the follow-up email with this recording, So no worries if you can't access it right now. If you are part of any university, we have a lot of read and publish agreements with institutes. So you will be able to publish articles with us without having to pay the article processing charges. The lists will be made available. In case you are not and you want us to connect with your institute to or refer us, we would be happy to come down to your institution and talk to the respective institution heads to provide details on how we can do a read and publish agreement. We also invite you to register with us as a peer reviewer with Kargar.